So welcome everyone to our career chat today. We are welcoming Angie Frye. She's a nurse manager at Spectrum Health here in Grand Rapids, Michigan. And we're thrilled to have our local experts on our career chats. And we're gonna be doing 2 months of health care focused ones. And Angie's our first today. So thank you, Angie, welcome.
Thank you.
This next 30 minutes is gonna go really fast. Super excited to ask you questions to give students kind of insights into what your career is all about. So just to get us started, Angie, think back to when you were 15 or 16, maybe 17 in high school. Did you think you'd be a nurse when you grew up? What were you thinking, and how did you end up where you are today?
Yeah, so I was one that didn't know that I wanted to be a nurse or to go into the healthcare field. So I was actually in a car accident when I was about 8 years old. And it was a pretty serious car accident, and my mom did not do well with seeing injuries and such, so she happened to be passing out quite often on the stretcher next to me in the hospital. And I had this fabulous ER nurse that was there next to me and just talked me through, and I really looked at her as an example, and pretty much thought from there that I think that's something that I would want to do, is be a nurse. There was some points in time through probably mostly high school too, where friends came to me for a lot of advice and such too. And I thought, well, maybe a psychologist might work, but came right back to nursing and decided that that was definitely something that I wanted to do. So, yeah.
Well, that's great that you kind of through negative experiences, and I guess I want to encourage students that I do hear often that adults will have an experience, maybe a grandmother who has passed from oncology, so that kind of sparks an interest. So be paying attention to that, young people. If you have those kind of experiences, it can trigger a real strong interest. So tell us about your early days right out of high school. Was it difficult to choose a college? Was it something that you knew right where you wanted to go? Kind of help kids understand how you made some of those decisions.
Yeah, sure. So I lived until I was about 12 or 13 in Ann Arbor. So I'm a big Michigan fan. So I say go blue for that. And then we moved actually to the Michigan State area. And so that actually confused me a little bit, thinking, okay, where do I want to go? But I personally like more of a small town feel and more of a smaller campus feel, or at least I did when I was in high school. So I did tour a few campuses and kind of looked out to see where the best nursing programs were, and just from some friends and family members that I knew, to see, okay, where would they suggest? And after doing some investigations, I ended up with one in Ohio, which completely out of the blue, and then Grand Valley State University. So I ended up choosing GVSU because it's closer to home. It was a couple hours from home, but still closer to home. And it was a smaller field at that time. Grand Valley has grown quite a bit. I graduated from there in 2002. So it makes me I feel old a little bit when I say that. But it was a smaller campus then, and I still feel like it has a small campus feel now as well. So I did decide I wanted to do the 4-year program, the BSN. So there's an ADN program from nursing, and there's also a BSN program. And
what's an ADN? Can you give them what an ADN means?
ADN is associate degree, so it's a 2-year program. And then there are some opportunities that ADN can be a registered nurse too within like the hospitals in different areas, but the BSN has a little more into understanding the research and the policies and procedures behind some of the thought processes within nursing, a little bit more of those classes involved. And then typically there's some leadership type of opportunities that the BSN degree gives opportunity for.
Yeah, some students may not know that you can get a 2-year degree in nursing. In fact, GRCC has a 2-year program. So heads up, young people, if you didn't know that, check into that. I'd love for you to tell them, some may not know what the direct admit means versus getting into a program then having to apply. So could you help them understand maybe what that was like for you and what you know about that today?
Sure. So when I applied, there actually was not a waiting list. It sounds like today there are waiting lists out there. But when I applied, for a 4-year program, you have 2 years of prerequisites, and then you have you get into the program, and then 2 years of the pure nursing program was when I was going to school. So right now, if I just talk about Grand Valley or the 4-year programs, they still have the 2 years prerequisites for the BSN program and then 2 years of nursing. There is a few programs out there that have accelerated BSN programs, and those are typically in like a 2.5 year track. I don't know exactly how they mix in any prerequisites in nursing together there, but that is an option for some that people have been taking advantage of too. As far as now, there is waiting lists out there for nursing, which is kind of good in the sense that there's a lot of people who want to be nurses, and we're super excited for that. But it's a little bit with the competitive of trying to, apply for that nursing program, and sometimes people might have to wait a year or so to get into the last 2 years of that nursing program. But in the meantime, that's also a great opportunity. When I started at Grand Valley, but the last couple of years in nursing program, I became a nurse tech or a CNA that was at a nursing home, and actually I went to, when I was on break, would go home and be a CNA at a nursing home in that area as well, and that's a huge experience. So highly recommend that. I always say for anyone that I hire, if you're going into the nursing career or even just thinking about it, to try out that nurse tech or CNA experience too, and that gets a lot of experience there.
I think that's an excellent suggestion, and young people, please listen to that, because how do you know if you really want to do it or not? And so by doing some of those entry-level positions, and young people often tell me too, like they really want to understand how to get from here to there. And so that career ladder, you're giving such a great suggestion. So BSN, again, is a Bachelor's of Science in Nursing.
Yep.
And then the associates, the ADN, was that the acronym you used?
Yep, ADN is Associate's Degree Nursing, so that's a 2-year program. Yep.
Okay, great. When someone's asking in the chat, do you have to go to nursing school to be a nurse?
Yes, you do.
Yes.
You have to go through nursing school, and then you actually have to take an exam after, and then pass that certification to get a registered nurse license.
Absolutely. So I know that you're a nurse manager now, but take us back to right out of college. Did you know what part of the hospital you want to work in? Have you worked in different departments? And then how did you end up being a nurse manager? Help us understand what your kind of daily work was like back then and what your daily work is like now.
Yeah, so really when I got out of college, I thought I was going to be a pediatric nurse. Like I said, I was a CNA at a nursing home, so I had that nursing home experience, but I loved kids, and at that time it seemed like everybody wanted to be a pediatric nurse. So the open positions were not in pediatric nursing, and next I interviewed for a couple different units, and both managers I interviewed with were fantastic, but I connected with one a little bit more, and it happened to be on the neuroscience floor. And so that has, many of the patients have strokes or have similar aspects of care needs that was at the nursing home. So I thought, you know what, I know this patient population, and there's nothing open in the pediatric nursing, but this would be something that I would enjoy too. So I did start on the neuroscience unit. And actually have been there 18 years now through different transitions of leadership. So I really love bedside nursing. I couldn't do pediatric nursing now. I think especially once I had kids, it would be too difficult for me to do that. But neuroscience nursing is really exciting. You learn something new every day. You take care of stroke and patients who have seizures, and just multiple array of different patient populations. So I always tell people I'm a bedside nurse at heart. I just love taking care of the patients at the bedside, being there during those difficult times, even though it can be hard. It's very rewarding for sure. So I did not foresee myself in leadership. I thought, I'd always be a bedside nurse. I still feel like I am, because I still go out there and help with those patients. But probably about 6 months into it, so fairly quickly, I became a charge nurse. And that's the nurse that's on the unit that is overseeing the floor and the nurses, and making sure the patients are getting well taken care of, and supporting the nurses that are out there on the team. So for example, I have 6 nurses on right now out on my unit. We have 22 beds, and there's a charge nurse that's just helping monitor with those 6 nurses, being a resource for any needs and such too. So I did that for quite a while, and then I became a day shift supervisor at that point in time, and really I enjoy mentoring. I enjoy the bedside nursing piece and taking care of patients, but I also enjoy mentoring new staff. And so that's why the supervisor position was of interest to me. And I got to do kind of both with that position for sure. And then we opened a second neuroscience unit, and after 2 years, and I was able to take the nurse manager position here. And then next, and really what that is a little more, I still can go out there and help out, and I love to do that. I'm also still mentoring the staff, but I also have some of like the financial viewpoints and hiring and just multiple meetings with physicians and other groups to make sure that the unit is running the way it needs to run, for sure.
Well, I think it's wonderful for young people to really hear that there's a career ladder once you get into nursing. And one thing I've learned in my role is that nursing is an amazing career where you can go to so many different places. And I just want to clarify, some of the young people had questions. It's a 4-year degree, although you can get a 2-year degree if you do the ADN. But it's a 4-year degree. You don't have to have a master's to be a nurse. Lots of options once you get in, and then you start to specialize your training once you get hired into a department. So you kind of get your basic skills as a nurse with that 4-year degree, and then you specialize with neuroscience, for example, like you are.
And as you said, there's several opportunities. So nursing is I might be biased, but I think it's an awesome career for sure. And, there's nurse educators out there. So those are the nurses that help educate our new staff coming on and our staff that are here with new processes that are coming into place. There's people go on to become nurse practitioners too, or, they might think about the PA route and start as a nurse. There's
what's a PA, just for some people that might not know that.
Physician assistant. Sorry about that.
Okay.
Physician assistant. So sometimes they'll go back for that type of degree, but typically it's then like a nurse practitioner. There's also what we call CNS, Certified Nurse Specialist. And so they look at processes and evidence-based research and help bring that into our hospitals as well. So there's lots of avenues. There's quality. There's definitely a lot of choices that you can go with nursing. And there's hospital, you can go in the hospital, you can go what we call ambulatory. So that's more of the surgical sites that are outside of the hospital, or clinics within the physician offices and such too. So lots of opportunities.
Yeah, so hopefully that helped answer Bianca's question. She was asking about kind of promotions and climbing the ladder. So thank you for sharing that. Some of the students are having questions about, well, one asked, what are some of the hardships? What are some of the tough things about being a nurse? And do you have to see a lot of blood and gore, or are there nursing positions where you don't have to see any blood and gore? Because I think young people kind of worry about that.
Yeah. So as far as blood and gore, it kind of depends on where you're at with what you choose, what path to go in with nursing too. So in the hospital, you probably will see a lot of the blood or, bodily fluids and such too. If you go outside, you might not, like in the clinics with the physician offices, you might not see as much, but you could still see some of that as well. I'm sorry. Can you remind me what you said? What was
some kids were wondering how you handle some of the kind of the blood and gore, or some of the really even hardships with your patients, that people are really suffering. I think kids wonder, like, am I gonna be able to handle that emotionally to be in such a difficult role?
Yeah, it is difficult. It is, it's something that you have to have a heart for people. I always tell the staff that I hire or staff that are working with me that, if you're compassion, you have that compassion and that desire to help people out. That's what's important. We can teach the task, and we can teach, beyond what you learn in school, and we can teach those task-oriented type of needs that are out on the unit, but really being able to be compassionate, sympathize, and empathize with the patients. I think the hardships are those times when maybe someone's not making it. As a nurse, we want everybody to be healthy and help them out as best we can, and sometimes we're not able to keep them going through life. And but sometimes it's just kind of reflecting, and it might be a stage of their life that this is okay with them, and being okay with that too. Definitely, during times right now with COVID and such too, of trying to, I would say one of the hardships, this as was out there for many people to see too, is when we didn't have visitors here. So just making sure that we're being able to be there for them, and having the families trust us, and be able to connect everybody. And it can be emotionally taxing at times, but it's the rewarding piece of it as well, to be able to be there for someone that's experiencing hardships, and being able to be an important piece of their life to help get them through it.
Absolutely. That's a beautiful thing. It sounds like something you really like about your job, like you said, being bedside. And I just want to encourage young people, as you're considering nursing, there are nursing jobs that you never have to deal with any blood or body fluids. I think about certain positions in public health. There's even at NeuroCore, I heard there's, nurses there. So please do your research and talk to the different specialties, because again, for some nurses, it's just not part of their day. There's also 9-to-5 type schedules, right? Or the 3-12 hours. So all sorts of schedules. We think about people doing eye surgeries. They're in and out from a 9-to-5 shift kind of things, weekends off.
Right.
So lots of flexibility for sure. The students want to know, what is your kind of favorite thing about your job and the thing you don't like about your job?
Oh, goodness. The favorite thing is, I think just talking a little more about, that bedside getting, we talk about thank you ma'ams. So those times that you're just really helping the patients or the staff out, and, they just really appreciate it. It kind of melts your heart, I guess is the best way to say it. When, you're really there to support them, hold their hands, talk through different things and getting to know people. I love building relationships. Even though it's a snippet of someone's life, or in my case, I also, with mentoring the staff out there, being able to get to know each other and understand how to help each other out is what I just love about the job. I also love, because I'm in neurosciences, just being able to learn something new every day. It's always a busy job, but you always learn something new. And I've been here 18 years and I still learn things new, and I still ask questions and such too. So that's what I love about my job. As a nurse manager, what I don't like about my job, it's probably even with the nurses too, is that some days it just feels so busy that you wish you could spend more time and get things done, what you feel is ideal, as far as, if you could wrap everything up and have a perfect, bow on it and such too. And some days you go home just feeling like you didn't quite get there yet. And so those are the hard times.
Yeah. Would you do it all over again, Angie?
Definitely.
Still be a nurse? Yep. If you
Yep.
could do it all over again?
Yeah.
One of the students want to know if you would still do it all over again.
Yeah.
As far as some of the things that students are taught in school are what are considered soft skills or employability skills. Tell us why those things are important, like teamwork or good communication or taking initiative. What are some traits about nursing that qualities about people that young people should have if they're going to be nurses? What are some of those natural traits and type of soft skills that you should have?
Yeah. So I always talk about teamwork. So even as people come in and nurse techs, I talk about it's super important to be able to work together as a team, be able to be comfortable with reaching out for help, because it is a team process. So knowing that it's okay to ask for help and not feeling like you have to do everything on your own is important for sure. We talked about having that experience beforehand with maybe a CNA or a nurse tech. That's a certified nursing assistant, is usually what they call for the CNAs for nursing home. But even with other types of whether it's food service or other jobs that you might be able to be part of, that you have the interactions with people. So any type of customer service experience beforehand is really important, because I always, at least for the hospital aspect for the nursing, as people come in, it's usually pretty traumatic. They don't expect to be in the hospital. And so sometimes they don't always behave like they would normally behave outside of the hospital because they're going through a traumatic experience. As being able to know, how to respond and having that calm presence and talking through that as well.
Yeah, that's great advice and very good feedback for sure. And I do want to just remind young people, as a young person, you could actually start working in dietary if you're under 18. At Spectrum Health, they have a role that you can work Tuesday, Thursday evenings from 4 to 8 every other weekend, and start getting yourself pushing food around. But you'll start to meet people like Angie, start to see what's happening on the floor. It helps you start to realize, is this the environment I like? Also long-term care, like nursing homes, those kind of nurses, they do very different work than Angie does. So again, if you can volunteer, those are the things you can be doing to kind of get from here to where Angie is. But some of the students are wondering, as far as high school classes or other experiences you might think they should be doing while in high school, in addition to maybe doing a nurse, maybe an assistant, like a nurse tech. I think you have to be 18 to be the nurse tech, so some of them can't do that yet. But what other suggestions might you have?
Did you say for classes or
for classes and maybe other experiences in addition to doing customer service, which you just recommended?
Yeah, so I would, I would go ahead and suggest definitely if you're interested in like the sciences, I think the sciences and kind of the maths, and that if there's any type of like an anatomy class or that's really something that will kind of let you know if you're interested too in the nursing. And what you were suggesting, we have, environmental services. So they help us with getting our rooms cleaned and transitioning our rooms as people discharge and come in, or nutrition services and such too. And as you were talking about, they have the opportunity to see what units they like, what areas they like, the interactions with different teams, and seeing what they're interested in. So a lot of times we do hire people as they are transitioning within their career to our units that have been within the system, that have they'll come to me and say, I've really enjoyed coming to your unit. I really enjoy that team there. I would love to work here. And when they're able to, we'll do that for sure.
So as you guys can hear that when you work an entry-level position like environmental services or the nurse tech, or excuse me, the nutrition tech is what I meant to say, you are starting to build your network with those staff on those floors, and it really helps get your foot in the door when the time comes. So please consider that. If you're going to be working after school anyway, why not get your foot in the door at the hospitals? And you can go to their websites to learn about the openings that are there. We just have about 5 minutes left. What do you see as far as some of the changes that you've seen in healthcare, and what's going to be maybe happening over the next decade or two?
Yeah, so I would say that COVID has really actually sped through some processes that we were thinking were coming in the future. We do a lot of like telehealth. So that is for, our smaller hospitals. We were already working where physicians are able to speak through the computer screen while they're in the ED department or in different departments through other hospitals, and trying to connect that way. But also even outside of the hospitals, where we have the My Health application, where people, and I know there's different applications out there for different systems, but people are able to make virtual visits with their physicians. And just the other day they were talking about the curbside flu shots and such too. So I think that healthcare has really looking at a different transition, where the hospitals are still important, clinics are still important, but people who don't necessarily have to come in to get seen or checked out, we're trying to figure out ways of making that happen, and probably faster now than we thought beforehand. But yeah, the curbside, like probably nothing that I would have ever thought of would be like the curbside flu shots, or the they're talking about in the news lately, or the COVID swabs, of being able to do the drive-through swabs, and the virtual visits. So I think it's just trying to be really innovative, and that's what we're looking at for the future of healthcare, is how can we be innovative and meet people to where they're at, versus having them always come into the hospital or the clinics and such.
Yeah, I love that, just the more patient-centered philosophies too, of putting things in the same building, so people don't have to go to a pharmacy and a lab and all different things when people have transportation barriers, for example, too. So it's an exciting time, it sounds like, in healthcare. Like I say, COVID kind of pushed some of that telehealth to the next level.
Right.
So people are asking if there's any other clinics or hospitals you can start under 18. And as I put in the chat, you guys, you can do environmental science or environmental services or nutrition tech under 18. So again, go to the hospital websites to read all about that. With some of your folks that work with you, Angie, some of the medical assistants, what do they do? And if you could then differentiate what the nurses do, so we can have a sense of each of their roles on the floor in your department specifically, obviously.
Yeah, and to just clarify, so medical assistant, there's a lot of different terminologies throughout the different systems. For ours, in general, medical assistants actually do have a certification or a degree. So if you see the medical assistant, then you do need a certification. I don't know a lot about the details with that, but here within the hospitals and different other areas, nurse tech is our other terminology, and that's where for us, you don't need a certification. We do on-site training, and then we have done also some virtual. So that's something new that we've been doing, is more of the virtual orientation and onboarding, and then do some more hands-on training after that. So our nurse techs, they are the ones, I call them our right-hand men. So they help us all the time. They take the vitals for our patients. They take blood sugars. So when they're eating, they help feed our patients, help us with ambulating, or mobilizing them, getting them up and walking. And then also being there. So as many people we can go in and out of the room and just say, hey, how are you doing? Do you need anything from us? It's just another partner to be able to do that.
That's great. I'm going to ask you to think about a final word of wisdom. It's actually about 1 minute before 4. And I'm going to share my screen and give them a couple of resources so they can continue researching about being a nurse and even a nurse manager. So think about a final word of wisdom, Angie, as I get ready to do this here. You've given us a lot of really great information in that 30 minutes. And students, if you've enjoyed hearing Angie share about her career path and about her job, I wanted to give you a resource called roadtripnation.com. It's a website where if you hover over career exploration and then click on interests, they have curated all sorts of personal stories of exactly what we talked about today. And so you can read and listen to more videos and hear more people's stories. So that's very, very helpful as you figure this out for yourself. So roadtripnation.com. And then for some of the nuts and bolts of, how much money do nurses make and what is a typical day like? And is this a growing field? Some of those kind of questions. This is one of my favorite resources called onetonline.org. So write that down, onetonline.org. And you just have to put in the word nurse and it'll give you all sorts of information. It will also give you similar jobs that maybe you never thought about. Like what is a nurse practitioner versus that physician's assistant? So it's a great tool to research. So I want to encourage you to do that. Let's see. This is our website, and this is where we have not only the career chats listed, careerreadiness.kenisd.org, but we also will have some talk-in tours. So we're going to have some virtual events taking place at a company, and we'll have a variety of topics. So check out careerreadiness.kenisd.org and see what other kind of program we have, you guys, that might be of interest to you. So I'm going to stop sharing with that. For those of you that are in the immersion program and will be earning a certificate, I will need you to put your name and school into the chat, and I'll follow up to make sure that I knew that you were attending today. So go ahead and do that before you leave, your first and last name and your school. So thank you, Angie. Give us that final word of wisdom to these young people as they're checking out healthcare careers.
Yeah, I would say if you enjoy people and if you have, a heart for caring, look into it for sure. There's lots of available positions out there within healthcare. And so there's different avenues to go by, but it's an awesome job to be a nurse. And I might be biased, but I say look into it, shadow, and really do some research.
Yeah, that's great. And young people, just be encouraged that job shadows will take place again, the in-person. Right now they're on hold, but it won't be forever. And Spectrum Health really does open up that opportunity. A physical therapy clinic actually might be able to get you in right now. So don't be afraid to ask, but they are kind of on hold temporarily, but I'm hoping in the early part of the new year, you'll be able to actually do job shadows. So we're gonna have something called Groundhog Shadow Day in February to help make some more connections. Angie, thank you so much for sharing your time today.
Yeah.
We really appreciate it. And I don't know if I did not include your email. Would it be okay to share that with students that attended today if they had any follow-up questions?
Sure.
All right, students, if you're part of the immersion, I will send that out to you. Actually, I should have done that earlier on the slide, so that's my mistake. I meant to ask you about that earlier. Can you give that to us? Is it just your name at spectrumhealth.org?
Yep, so angela.frye, F-R-Y-E, at spectrumhealth.org.
So yeah, angela.frye, F-R-Y-E, at spectrumhealth.org. So again, thank you so much, everyone. This will be uploaded onto our Career Chats website for those of you that want to watch it again or want to share it with someone else. But for now, thank you so much, everyone, for attending today. Have a great day. Thanks, Angie.
Thanks, you too.